Michael J. Fox once said, "I can't control my body the way I want to, and I can't control when I feel good or when I don't. But I can control how clear my mind is, and I can control how willing I am to step up if somebody needs me." 28 years ago, Michael J. Fox was diagnosed with Parkinson's disease, and he, along with the other 10 million Parkinson's patients, including my grandma, go through the constant struggle of not being able to control their body. In 1817, Parkinson's disease was first described as a neurological disorder in a paper titled An Essay Shaky Palsy by Dr. James Parkinson. Dr. Parkinson had 3 patients and noticed another 3 people on the streets who were experiencing what we now know as the classic signs of Parkinson's: tremors, rigidness, and posture instability. Prior to 1861, Parkinson's article got very little attention. However, it wasn't until neurologist Jean Martin Charcot and his colleagues distinguished this disease from other neurological disorders and named it Parkinson's disease. In this speech, I will be informing you the unique cause and diagnosis of Parkinson's, how it affects the human body, and various ways to cope with this life-changing disease. The overall main cause of Parkinson's is due to a lack of a certain neurotransmitter in the brain, dopamine. When most people think of dopamine, they think of a neurotransmitter that makes them feel good. However, it is also a neurotransmitter that is crucial for controlling a person's motor control. According to the Washington Post, Parkinson's disease is a progressive neurodegenerative condition in which the body's ability to produce dopamine, a compound that regulates movement, is greatly diminished. Normally, dopamine is produced in the substantia nigra, which is in the middle of your brain, which is also in the upper part of the brainstem. In Parkinson's, the number of neurons produced in the substantia nigra is low. Therefore, that is what is producing the low levels of dopamine. The chemical imbalance of dopamine in the body is what is causing the clinical symptoms. Parkinson's disease isn't like most diseases where it can be diagnosed through a scan or a blood sample, but it's diagnosed through the signs and symptoms. According to Nature.com, the diagnosis of Parkinson's relies on the clinical effects of the dopamine deficiency. This disease is associated with other neurotransmitter deficits that are recognized to cause various motor and non-motor symptoms. My grandma, for example, was experiencing the chemical imbalance for years. She had various MRI scans and had blood drawn regularly. However, the doctors weren't able to find out what was wrong with her. It wasn't until she was referred to a neurologist in which her doctor asked her a series of questions based on the signs and symptoms that she was experiencing. She was asked to put her fingers together, act like she was accelerating on a gas pedal, and had to walk a certain distance, while she was also asked about her daily living activities. By conducting this exam, the doctor was able to notice the tremor in her arms and legs and the immobility while she walked. And after this appointment is when my grandma was officially diagnosed with Parkinson's. People with Parkinson's not only experience motor symptoms, but they also experience non-motor symptoms. Some of these non-motor symptoms can include depression, various cognitive disorders, and fatigue. These non-motor symptoms can be caused by the constant stress and frustration of this disease. However, they can also be side effects for the medication. After a patient is diagnosed, the neurologist will provide a specific treatment plan to help manage the symptoms for the patient. Parkinson's disease is a disease that is uncurable, so medications and therapies are ordered to stop the disease from progressing. According to the JAMA Network, although no available therapies alter the underlying neurodegenerative process, symptomatic therapies can improve a patient's quality of life. Levodopa is the most effective medication available for treating the motor symptoms of Parkinson's disease. Now, you might be thinking, why can't a patient just take a pill that is directly dopamine? And that is because dopamine can't cross the blood-to-brain barrier, meaning that the chemical won't travel properly to reach the brain and replace the chemical. That's why levodopa is given as a precursor to pass the blood-to-brain barrier so it can reach the brain and then be converted into dopamine. So if you look at this diagram here, the levodopa is taken as a pill and then is able to use as a precursor to then enter the bloodstream and then be converted directly into dopamine. My grandma currently right now is taking levodopa, and she's taking a form that also has carbidopa in it, which is known as carbidopa-levodopa. When carbidopa is added to levodopa, it acts as a chemical to prevent nausea. It also stops the levodopa from prematurely being created as a neurotransmitter and entering in the bloodstream. For my grandma and many other Parkinson's patients, levodopa helps manage the symptoms that Parkinson's creates. When my grandma takes her medication and when she doesn't, you can tell when she does and when she doesn't. When she does, she's able to walk without severely stuttering. However, when she doesn't take it, she can't walk and she feels like she is stuck in place. Not only are medications a form of treatment, but so are various therapies. Patients can have a scheduled therapy with a therapist to get specific treatment that targets a certain area of the body that Parkinson's is targeting. However, patients can also do various general activities such as swimming, biking, or walking, just so that their muscles don't get rigid. All of these are forms of treatment, but they don't make the symptoms just go away. They make the symptoms more manageable. In conclusion, this life-altering disease is caused by lack of dopamine and leads to signs and symptoms like no other disease does. There are forms of treatment, however, scientists have yet to find a cure. Michael J. Fox is a legendary spokesman for this disease and has his own foundation called the Michael J. Fox Foundation. To date, this foundation has raised over $650 million to find a cure for Parkinson's while developing therapies for people living with this disease. Currently, the money raised has yet to find a cure for my grandma in her lifetime. However, I am hopeful that with more money raised and more scientific research conducted, that there will be a cure for Parkinson's in my lifetime. Thank you.